Closed treatment of a hip dislocation. 27250, closed treatment of a hip dislocation, traumatic, without anesthesia. Or the 27252, closed treatment of a hip dislocation, traumatic, requiring anesthesia. The physician treats the hip dislocation without anesthesia in 27250 or with anesthesia in the 27252. Two types of closed reduction techniques are used to treat hip dislocations depending upon the type of dislocation. The Stimson maneuver and the Alice maneuver. General or spinal anesthesia is applied. The Stimson maneuver is a procedure for posterior dislocations. The patient is positioned prone, that's face down, with the limbs hanging from one end of the table. Stabilizing pressure is placed on the sacrum. The physician holds the knee and ankle flexed to 90 degrees and applies gentle downward pressure to the leg just below the knee. The Alice maneuver is a procedure for anterior dislocations. The patient is positioned supine, face up, the pelvis is stabilized, and lateral traction force is applied to the inside of the thigh. The physician applies longitudinal traction in line with the axis of the femur and then gently abducts the internal rotates the femur to achieve reduction. Other techniques similar to those described may also be used. After reduction, light skin traction may be applied. Coding tips. Codes for reporting hip dislocations are depending upon the cause. Note whether the dislocation is described as traumatic, spontaneous, congenital or pathological, or post-arthroplasty. Report separately an X-ray used to diagnose the fracture and dislocations, and supplies used would be reported with A4570. Check with your specific payer to determine coverage. Terms to know. Alice sign. Diagnostic sign that helps determine if a femoral neck fracture is present. The patient lies supine with the hips and knees flexed. When an unequal upper leg length is noted and the knees are not to be the same level, it indicates relaxation of the fascia between the iliac crest and the greater trochanter in a femoral neck fracture. Anterior, situated in the front area or toward the belly surface of the body. An anatomical reference point is used to show the position and relationship of one body structure to another. Arthroplasty, surgical reconstruction of a joint to improve function and reduce pain. Arthroplasty may involve partial or total joint replacement. Coding depends upon the site and the method. Closed treatment, realignment of the fracture or dislocation without surgically opening the skin to reach the site. Treatment methods employed include with or without manipulation and with or without traction. Congenital, present at birth, occurring through heredity or an influence during gestation upon the moment of birth. Dislocation, displacement of a bone in relation to its neighboring tissue, especially joint. Pathological dislocation, displacement of a bone or joint caused by disease process such as infection, lesion, or muscle weakness and not traumatic injury. Posterior, located in the back part or caudal end of the body. Skin traction, application of the pulling force to a limb accomplished by a device fixed to a felt dressing or straps on the body surface. Traction, drawing out or holding tension on an area by applying direct therapeutic pulling force. Your codes 27250 and 27252.